Hi there, it's Dr. Emily Porter from Wrinkle Free MD Med Spa and Wellness Clinic of Leander, and I'm here to talk today about a problem called Peyronie's disease, which is actually probably a lot more common than what we know about because a lot of men don't know that they have it or they're embarrassed to talk to their doctors about it. But it's still pretty frequent and prevalent, and it can be really, really upsetting to men. And what Peyronie's disease is it's thought to be an inflammation of some connective tissue in the penis, sometimes caused by trauma, sometimes not. We're not really sure exactly what causes it, but we know what can it affect, and it can cause some plaques to build up in the connective tissue in the penis. It can interfere with the erections and the ability for the penis to expand, which can unfortunately cause a curvature. A curvature so bad sometimes that men are unable to actually penetrate their wives because their penis is so curved that it's not technically possible, just because it's difficult technically. So another bad thing is that there hasn't been a great treatment for this in the past. There's surgery. Most urologists are reluctant to do it because it doesn't have a great success rate. It can lead to more scars, more plaques, more bend. So a lot of men are not willing to risk that because they don't want things to get worse than what they already are. And then there's Xiaflex, which is an FDA-approved drug that's very, very expensive that can help dissolve some of the plaques, but it can also dissolve some of the normal penile tissue, which obviously people don't want either. So there's a safer, newer option that works pretty well. It's called the Priapus shot, and we have it in our office. And what I do is I have you come in and we talk about what's going on, and you describe your situation. We actually look at the problem directly. We can look at the erection, you can show me what's going on, and then I have an ultrasound machine and I can visualize the plaques. I can look at how deep they are, I can look at how thick they are, I can look and see exactly where they are. We take your blood and we spin it down, a couple tubes of blood, and we turn it into something called platelet-rich plasma, which is the goo that you get underneath your scab on your knee when you fall and skin your knee. So it has healing, regenerative properties, and we can inject it into certain areas of the penis, and also we inject some of it right into those plaques, and we can do it under ultrasound guidance. This makes it even more safe, and most people don't do that. It's very safe, it's very painless, and then afterward we have you use a pump and use some medications and some things to kind of help get things straightened out for you. So what's possible is that I like to be able to reduce the curve. I think to be able to reduce the curve in the first year, so maybe by 25 or 30%, and just get you functional again to where you actually can be with your wife. It's not a cure. I don't really think there is a cure for Peyronie's disease. It's hard to cure something that you don't know exactly what it's caused by, and it's kind of a chronic problem. But there are ways to improve it to where you can be significantly better. And I've actually seen this. I mean, I had a gentleman in his 60s who came in last week who had not made love to his wife in 6 years, and checking his testosterone, fixing that, helping him with this therapy. We used some shockwave therapy, we used a Priapus shot, and he was in tears to tell me he loved his wife, but now he could show her that he loved her the way that he wanted to. So anyway, I hate this disease. I wish it didn't exist. It's horrible. I can't imagine what it would be like. I don't have a penis, so I can't imagine what it would be like to have my penis curved at 30 degrees or 45 degrees or even 90 degrees I've seen. But I love to treat it. I love to make it better. I love to help relationships. So if you think that if you're suffering from this and you want to at least talk and see if maybe I can help you, then please give me a call.